Hello, you're watching The Wire. Today is the 4th of May, and here are the coronavirus updates that you need to know. As of now, over 40,000 people have been infected by the novel coronavirus in India. Over 1,300 people have lost their lives, and over 10,000 have recovered. According to latest data, 2,487 new patients were reported in a single day. On Sunday, India entered its third phase of the lockdown. It will be a 2-week long lockdown with some zone-wise relaxations. To learn more about what is allowed in which zone, you can watch The Wire's detailed video on the same, the link of which is given in the description box below. As restrictions ease in a phased manner, Union Home Minister Kiren Rijiju has said that national sports camps that were suspended due to the lockdown can be expected to restart from the end of this month. Odisha's Ganjam district, which had so far been a green zone, reported its first COVID-19 cases on Sunday. 3 people who had returned from Surat were tested positive, taking the total number of cases in the state to 160. A serving Lokpal member, Justice Ajay Kumar Tripathi, who had tested positive for COVID-19 a month ago, died on Saturday in the national capital after he suffered a cardiac arrest at AIIMS. Justice Tripathi, who was 62 years old, was one of the 3 judicial members of Lokpal and was admitted to AIIMS Trauma Center last month after testing positive for coronavirus. 71 more CRPF personnel tested positive in the Mayur Vihar camp in Delhi over the weekend, taking the total number of cases in the facility to 135. One CRPF staff member also tested positive at the CRPF headquarters in the national capital. The Mayur Vihar camp and the CRPF headquarters have both been sealed. The first infection at the Mayur Vihar camp was detected on the 20th of April when a paramedic who had returned from Kashmir tested positive. Last Tuesday, a sub-inspector with the CRPF died due to the infection at Safdarjung Hospital. Between the 1st of May and today, over 4,000 positive cases have been reported in the country. But in an interview to PTI, NITI Aayog member V.K. Paul has assured that the continuous rise in the number of people testing positive is expected to stabilize anytime soon. He said that the rationale behind the government's decision to extend the lockdown by 2 more weeks has been done after looking at consolidated gains from the first and second lockdowns. V.K. Paul currently heads the Empowered Group on Medical Equipment and Management Plan constituted by the Government of India to handle the pandemic. In a confusion over the categorization of zones in the states, the Principal Health Secretary of West Bengal wrote to the Union government that in the video conference with states that happened on the 30th of April, it was shown that as many as 10 districts in West Bengal were red zones. But according to the parameters of the Union government for characterization of zones, there are only 4 red zones and not 10. The letter called Centre's assessment of zones in states as erroneous and enclosed a correct classification of districts along with it. The Kerala Government Medical Officers Association or KGMOA have raised the issue of the quality of PPE kits and N95 masks that were delivered to them with the Chief Minister of the state. A sudden increase in the manufacturing of PPE kits and N95 masks seems to have put the quality of these items at stake. After a doctor in the Idukki district was tested positive, the KGMOA found that instead of a 3-layered mask, a 2-layered mask was provided to them, and instead of N95 masks, dust masks were provided. The South Indian Textile Research Association, which has been given the task to check the quality of these items, told the Times of India that around 90% of medical equipment that they receive fails the quality test. In a big announcement towards potential cure and treatment of COVID-19, the US Food and Drug Administration has issued an emergency use authorization or EUA for the investigational antiviral drug Remdesivir. The EUA allows for Remdesivir to be distributed in the United States of America and administered by healthcare providers to treat suspected or confirmed COVID-19 patients. The FDA in their statement said that given that there are no adequate, approved, or available alternative treatments, the known and potential benefits to treat the serious virus currently outweighs the known and potential risks of the drug's use. As many states in the America reopen despite increasing death toll, New York's governor has warned against blindly reopening states. He pushed back against what he called premature demands of the people. He added that he is fully aware of people struggling under stay-at-home orders, but urged people that understanding of coronavirus is needed in the country at this point. On the other hand, hundreds gathered at Oregon to protest the stay-at-home order. Most protesters waved American flags and Trump campaign signs and urged the country to be reopened soon. Researchers in France are preparing to launch a human trial to test their hypothesis that nicotine can help the body combat COVID-19. The trial will involve groups of healthcare workers and patients wearing nicotine patches and other groups wearing placebo patches. Then they will be tested to see if there is a difference in how their bodies respond to the virus. The trial is a follow-up of a French study published this month which shows that people who smoke are 80% less likely to catch COVID-19 than non-smokers of the same age and sex. That's all for today. Keep reading and watching The Wire and The Wire Science. We will see you tomorrow. Until then, stay safe.